Good morning. I'm Amanda Pedersen, news editor at MD+DI, and this is Medtech Unfiltered. And I do apologize for the delay in getting started today. During these days of the pandemic, technology is not always on our side, and today is one of those days at my house. Starting today, the Supreme Court is hearing oral arguments in the case filed by President Donald Trump along with 18 Republican-led states to overturn the Affordable Care Act. If the case is overturned, it would cause a major disruption to the U.S. healthcare system in the middle of a raging pandemic. If the case is struck down in its entirety, which is what the president is seeking to do, close to 21 million Americans would lose health insurance and protections from pre-existing conditions. Before Affordable Care Act went into effect, there were a lot of penalties. Insurance companies could deny coverage to people with pre-existing conditions, or they could charge them more for coverage. As I think most in the medtech industry would agree, the Affordable Care Act is not perfect, but it was a step in a positive direction for American patients. And at the end of the day, what's good for patients is ultimately good for the medtech industry. One of the most problematic aspects of the Affordable Care Act, particularly for medtech companies, was that it initially imposed a 2.3% medical device excise tax that ultimately cost the industry nearly 29,000 jobs, not to mention billions of dollars in R&D spending that could have gone towards innovation and next generation development and investments in startup companies, which of course are the lifeblood of the medical device industry. After years of aggressive lobbying, the tax was ultimately permanently repealed late last year, finally, which was a huge win for the industry. So instead of $20 billion going to the IRS, now that money is able to be put into hiring people in the medical device industry. So it goes towards jobs, it goes towards innovation, it goes towards those companies can deploy capital to expand their manufacturing capacity, which, as we've seen during the pandemic, has been particularly important. And also larger companies can invest more in startups. That said, however, the Affordable Care Act has done a lot of good things for a lot of people, especially those with pre-existing medical conditions, which includes myself. And speaking of pre-existing medical conditions, it's not completely clear at this point, but experts are warning that anybody who has had a positive COVID-19 test, or even if their diagnostic test was negative and they later tested positive for antibodies, those people could potentially be considered to have a pre-existing condition, which, if the ACA is overturned, they could face penalties down the road when they try to get insurance. Normally, a virus is not considered a pre-existing condition because it's usually short-term. But in this case, we've seen COVID-19 patients have had long-lasting impacts, organ damage, and things that would be considered an ongoing chronic condition. So here's my take. Are there parts of the Affordable Care Act that could be improved upon? Absolutely. Does that mean it should be scrapped in its entirety? Definitely not, and especially not during the pandemic that is costing so many patients healthcare and their lives, and It's just not the time for this. It's obviously a political move more than anything, and so it remains to be seen what the Supreme Court ultimately decides. But it will. It is something that, in one way or another, will impact every American, I believe. So it is worth watching. It's something that MD+DI will be following very closely, as it does impact the industry as a whole, and particularly the patients who, at the end of the day, are the reason that most people in the industry wake up and go to work every morning. So. I won't keep you since I got off to such a late start anyway, but I just wanted to share that since today is the day that those hearings will start at the Supreme Court. Thanks for joining us for MedTech Unfiltered, and I hope to see you next week.